think certainly what's top of mind for many of us is not only COVID and how to boost our immune system, but also the Delta variants, the impact of the Delta variant on the vaccine, the efficacy of the vaccines, how we can naturally improve our immune system. I've spent a lot of time this week, and mostly this week, a little bit last week, but really a lot of time this week on some of the research that's been coming out over the last couple months, and honestly, even the last couple of days, updating these. So I hope this is helpful for everyone. Please, let's have a great discussion here. And certainly, if you have any questions or comments, just put them in the chat. So we do want this to be interactive. But again, thank you for joining us today. This is our normal Thriving Thursdays time that we're going to be talking about navigating COVID-19. And I think I just wanted to say in general that we're all in this together. We're kind of like rowing this kayak, like these two people here are. We're all rowing this together. So I'm really appreciative of you all here and of being here today. So here's again sort of our general topics today that we'll be discussing. So we'll be discussing the COVID Delta variant, the research updates on COVID with the focus on Delta and the vaccines and how that impacts what's called VE or vaccine effectiveness. And then we'll also be talking about clinical protocols for how to strengthen and balance your immune system, which is what we call immunocompetence. And then we'll be talking about future directions that we think about for COVID. And I think no one has a crystal ball at all about it, but, and then any question or answer discussion. And again, feel free to jump in beforehand. So just a few updates on the clinic. So we are open in person and video. Nutrition and health coaching appointments are online. And you see the things that are in person. So medicine is available online and in person, but we also are doing lab draws, IV nutrition, which a lot of people have found beneficial, even for long COVID, for instance, like acupuncture, myofascial release, and procedures. And luckily, the insurance companies and Medicare have decided to continue coverage for telehealth for now. So that's really helpful, I think, to all of us so that we can have better access for appointments and things like that. And we have some really great virtual group visits coming up with EJ and Tony. So we're talking about smart health hacks, 5 simple steps you need to thrive. And this is on Tuesday, August 24th from 4 to 5:30 p.m. Learning about the 5 steps you need to feel your best and stay healthy in the long term. So please join EJ and Tony for that. That should be really great. And then with Ayla and Jen here, we have cardiometabolic nutrition group. So if you're looking to improve some stubborn belly fat, stubborn weight, metabolic syndrome, hypertension, elevated blood sugar, and some of these conditions are actually risk factors for COVID and severity of COVID. So it's really important to kind of get the weight, get that metabolic optimization going so that you can improve your overall health, but also your immune health as well. So that visit with Ayla and Jen is on Wednesday, August 25th from 4 to 5 on Zoom here. So again, we're trying to look at things to optimize health so you can take charge of your health a bit more. Now, we are going to be continuing our wellness webinars, which are still going to be happening at this time, 12 to 1 p.m. on Thursdays. And it has been for the past over a year, once a week. So we're actually going to have them a bit less frequently now, once a month, because we're going to be launching a CIH podcast, which you're all welcome to listen to as well, which we're very excited about. And we're launching that next month. And it'll be called CIH Podcast. So a very easy name to remember. So you can look that up on Apple. I think, Jen, you can let us know when that's available. Jen, maybe you can comment about that. If you want to write in the chat, that would be great. What topics are you interested in hearing about, both on these podcasts, but also on the webinars moving forward? Gut health, thyroid health, acupuncture, other topics. So I think definitely, Jen, was that question about the podcast or the webinars? I'm not sure.
Yeah, in general, just what topics do you want to hear about in the webinars or podcast if you have something you want to learn more about?
Because we are trying to bring this out to more people, including people that are not at CIH, but also we want to make sure that everyone here listening, that's really our first priority. So anything you want to listen to or learn about, and things like that on the podcast, let us know. We're going to be doing that podcast once a week. And Jen, I don't know if we have this yet, but what day and time would we be releasing that every week? I don't know if we ever talked about that yet, actually.
we're not quite ready to say officially, but we will
Got
let
it.
everyone
Okay.
know soon.
It's a surprise. It'll be a top
Yes.
secret. We're really excited about this. We have some great world-class guests on there already that we've already recorded, and we're going to be releasing that in September. So that's really great. And then Bobby talked about menopause and sleep, or lack thereof. Absolutely. Those are great topics to talk about. Yes, thank you. We're definitely going to be doing that. So just a couple of reflections, and we could just kind of all settle into our bodies and kind of ground ourselves here as we get to some of the deep dive research stuff we'll talk about today. But what is this, just kind of some reflections as you take some deep breaths, maybe put your hand on your heart if you'd like. What has this COVID pandemic time taught you? You know, what lessons are you taking away from this that will serve you and your loved ones better in the future? And then also, you know, as during this time, this has been very difficult, I think, and challenging for all of us here, and we're all in this together. Of course, how are you staying grounded in your body to keep balance during this time? Maybe you're doing some 5 seconds in, 5 hold, and 5 seconds out breathing. So maybe we'll do one of those right now. Take a deep breath for 5 seconds. Hold your breath for 5 seconds. And then exhale for 5. Let your body just kind of settle into your chair here. Feeling your feet on the ground, connecting back to yourself. And then as you keep on breathing, during this talk even, you know, during this discussion, and anytime you're going about the day, talking with people, or if you're sitting alone and thinking to yourself, you know, things, just acknowledging any sensations and emotions that arise, whether it's fear, whether it's love, whether it's courage, anything kind of in between that. It's really important during this COVID-19 time to stay grounded in your body to keep balance. And that's going to really help your immune system. That's really important, and I can't emphasize that enough. So please keep doing that. Keep getting grounded with your breath, with your body. It's going to serve you really well. So we'll talk first about, we'll start broad and then we'll kind of go deep with the research. So let's talk about the broader perspective of COVID-19 and some of the updates here. So worldwide, there's over 200 million cases now of COVID, over 4 million deaths, and including over 620,000 deaths in the United States from COVID so far. In addition to physical health, there's also emotional and mental health tolls. A lot of people now have anxiety, depression. This has been a collective trauma for all of us. There's also this idea of the effect of social well-being, of, you know, going from connecting and seeing people in person all the time to having isolation, you know. So there's been a big worldwide toll, not to mention financial tolls, et cetera, too. So just to kind of acknowledge that. In addition to that, not only that, but a lot of people had to deal with, especially in the West Coast, the wildfires. So there's actually studies that show that the wildfires are making the severity and incidence of COVID worse. So if you want to read about that, there's a link for that. And then just as an idea of sort of as we look at COVID, and we're all kind of living through this time now, this is probably the only time that we've ever lived through a pandemic, unless you were born in 1918 or earlier. You know, if you think about it, you know, past, present, and future, this is a pandemic. This is something that is life-defining for a lot of people, but at the same time, there may be other future pandemics. So how do we prepare for that? So we'll talk about that as well. Here's some official resources. Won't go into detail on this, but CDC, WHO, DMV area coronavirus websites, as well as Montgomery County local websites as well. Now let's talk about where we are right now with COVID. So as of August 8th, which is the latest data on that, worldwide about 9,000 people are dying from COVID every day. And just yesterday here in the United States, there was a 7-day average of 650 deaths, and over 1,000 people did die of COVID. In terms of Maryland, DC, Virginia, you see those numbers there. I won't repeat those, but typically the past 30 days, daily new cases have gone up by about threefold, but deaths have remained approximately stable and, you know, relatively low compared to other parts of the country. There are states with record new cases currently in Florida, Mississippi, Louisiana, Hawaii, and Oregon. Now, here's some great questions. Thank you for the submitter who I see on here. So thank you for attending here. Does natural infection or vaccination protect better against COVID? So we're going to look at some studies that look at that as well. And then what are some major modifiable risk factors for COVID-19, morbidity and mortality, meaning like serious COVID, hospitalizations, or death, and how to best strengthen the immune system so that we prevent that. So thank you for those submitted questions. So first of all, I'll just say that we don't know what we don't know. You know, people do what Dr. Shaw says from Yale is that, knowledge about this novel coronavirus, this nCoV-2 is still evolving, and people get confused. We get confused. I get confused. We think that something is wrong when guidance changes. Why did we say, a week ago, hey, there's boosters for everyone is not going to be needed, and then now we're saying we're going to do boosters for everyone. So we have to remember that we're learning about this as we go. When guidance changes, even if it changes in a short time period. So I agree with that statement from Dr. Shaw, but I also think that I also feel like we need to have critical thinking skills. We have to know when we look at research and we look at some of the data behind all this, what is being studied? Are we asking the right questions? And what are the underlying assumptions behind hypotheses, behind these ideas of, okay, this is what it might be. We also have to actually read the studies because a lot of the news headlines are very misleading and don't really go into the whole detail of papers. So that's what I kind of did for you, 10 hours of research on this for this talk today, so we can understand the potential policy implications or action items for the data, if any, but we want to look at how that actually manifests clinically for health and for clinical outcomes. And we do have a need. We all have this human need for a locus of control, and we all have this need for a certainty in an uncertain world. But we know that things are kind of slippery. Things are kind of changing with regards to the data and knowledge. So just know that we naturally have a need for a locus of control. At the same time, we also need to know that we need to dig deep into this research to really understand what it all means for us. So again, I'm still a little broad here, so Jen, let me know about the time, but there's hundreds of coronaviruses worldwide. So why has this caused a pandemic? Why is COVID-19? First of all, it is a zoonotic virus. It's jumped from animals to humans. This is the idea of this in any case. And so this is the 2019 nCoV or novel coronavirus. So this is not something that our immune system has ever seen before. And because of that, is subject to trigger more inflammation, contagiousness, morbidity, and mortality in humans, because it literally is a new virus for us. And that's why it's taken a couple of years here to kind of get everything rolling. All coronaviruses can cause mild symptoms. That's where you see the common cold symptoms, but they can cause more cases, especially in children, bronchitis, pneumonia, and even respiratory failure, and potentially systemic dysfunction of the gut and the brain and the other areas. So all coronaviruses could do this. Why is SARS-CoV-2 doing it more? It's because it's a new virus for us. I wanted to mention this because we're getting into flu season very soon here. And I know the flu cases have gone down quite a bit over the last 2 years because of, I think, the social distancing and things like that. But in any case, let's compare really quickly COVID-19 versus influenza. So both do cause respiratory tract symptoms, as you probably know. Both use surface proteins to infect the host. So COVID-19 uses a protein S, which is called the spike protein, S for spike. And then the flu or the influenza virus uses two proteins called hemagglutinin and neuraminidase. And so these proteins need to work in order to infect the cell, and there's ways to disrupt these proteins as well. So another comparison, so basically in terms of mutation rate, that was a question. So basically the novel coronavirus versus influenza, they're mutating at least at the same rate, if not maybe coronavirus is a little bit higher actually. However, influenza does have a shorter incubation period, I think somewhere like 1.7 days. The initial original coronavirus was 6 days incubation, and Delta is about 4 days, which I'll cover later. However, you're more likely to get pneumonia with the novel coronavirus. In one study from China, they found that 90% of people got some sort of pneumonia. Even if you don't know you have pneumonia, if you check a chest X-ray, you'll see some scarring and things like that. So that's something to know about, I would say. And then we're going to get into Delta now. So we had the original strain, which is called B1. And then that kind of mutated into alpha, which is B117. And then you see alpha, beta, gamma. And now you have Delta. So Delta is more contagious than alpha, and that was more contagious than the original strain. So Delta actually has a viral load up to 1,000 times that of the original strain, which is why we see so much more, I think, spread, going on. So you can read that study there if you're interested. So this finding from China in July was confirmed in separate studies by the Public Health group in England. I guess it's called Public Health of England in the UK, as well as the CDC in August. Please ask your questions there. I will get to the chat in a minute. Thank you for the questions that you're having, because I know there are probably a lot of questions. So here's some key points about Delta. So the key points are that Delta does cause more infections and spreads faster. So the incubation period is 4 days versus 6 days. It appears to be causing significant numbers of infections in both unvaccinated and vaccinated individuals. So we used to call them breakthrough infections, but breakthrough implies sort of that, not many people are getting it. But in fact, a lot of people are still getting infected, even if they got vaccinated. So we're going to go take a deep dive into research in a couple of slides from now. There are a couple other variants. There's Delta Plus, which is basically Delta plus some beta mutation variant. However, luckily, that does not appear to be taking over at this time. Let's talk about Delta versus Alpha or other variants. So traditionally, I think there were some other symptoms, but definitely, COVID Delta kind of looks more like your common cold: headache, sore throat, runny nose, stuffy nose, nasal congestion, fever, dry cough, sneezing, loss of smell. So some of these are kind of like, well, this is kind of like your common cold. Loss of smell is not really seen as much with the common coronaviruses, I would say, but it is possible. Other symptoms include nausea, vomiting, diarrhea, loss of taste. So should you test if you have cold symptoms and if you got vaccinated or not? Should you test for COVID? I think it depends on a couple of things. You can go to this website called covidactnow.org and you can see if the risk level in your community is high, and if so, the recommendation is to test. I think the CDC is recommending people test in general. And then if you're around people that are immunocompromised, maybe people that haven't gotten vaccinated, maybe children, maybe people that are immunocompromised in terms of their health, you may want to consider getting tested. But you can see that basically the common coronavirus, the novel coronavirus versus common coronaviruses, they're basically the same type of symptoms. There is another key point I want to make, which is that asymptomatic individuals can spread the virus to others. So this is another new thing with Delta that wasn't there before Delta, I think, is that it was thought before and it seemed like people that were not symptomatic were not spreading, but now we know that people are. So that's another key point. Now the Delta variant in many parts of the world, including the US and Europe, represents greater than 93% of all new COVID cases as of this month. There are at least 7 and I think maybe 8 mutations in the spike protein that are allowing for escape of neutralizing antibodies produced by the B cells. So what that means is your body produces antibodies if you get an infection, or your body produces antibodies if you get the vaccine. But these mutations are allowing for some degree of escape from those antibodies, in which case the virus can then get inside the cell. At that point, it will elicit a T cell response to try to go inside and kill those viruses off. So your body's not done with trying to get rid of it, but it has gotten sort of escaped past that first line defense, so to speak. So that's what we're talking about. That's why we see breakthrough infections with Delta. So B cells and T cells are kind of keeping the rates of serious illness down, even if you get infected and the virus starts getting inside your cells and bypasses those antibodies. It is still reducing the risk of serious illness, which basically means hospitalization or death, down for those who are vaccinated and for those with prior history of COVID infection. Now, symptomatic breakthrough infections among vaccinated individuals, it was estimated at less than 2%, but now experts are estimating the total number is closer to 10%, including people that are not symptomatic at all. And I think the numbers are likely to go up without masks and social distancing. So that's why I think it's important to kind of keep going with those guidelines there. My clinical experience suggests much higher when patients talk to me about, are they getting COVID or not? I think a lot more people are getting COVID, maybe than we think, that are out there, even if we got vaccinated and everything. So let's talk about vaccination now, and we'll get into that, and then we'll get into some more research. So rates of vaccination. So 23% of the world is fully vaccinated. Now let's take a step back for a second. So that means that, what is that? 77% of the world is not vaccinated, and there's disparities in distribution. So what that means is that over 80% of the vaccines have been kind of given in sort of high capita income countries, like the US or European countries, et cetera. And less than 0.3% of vaccines have been given in poorer countries. So there's a huge disparity there. So when we talk about 23%, it's not like 23% of every country has gotten a vaccine, right? Rates of natural infection, we don't know exactly. It's likely underestimated. We know there's at least 400 million, but there's many more than that, probably in the order of 3 or 4 times that amount potentially. The CDC is saying that the risk of infection or death is much higher if not vaccinated. And I think that seems to be the case based on the statistics, but you have to stratify the risk as well. It depends on the age, it depends on your age, it depends on your health conditions and things like that. Delta has spiked the US cases, which we just saw in one of the previous slides, but mortality rates are following a relatively lower curve overall still, which is a good thing. And then looking up some research on vaccine effectiveness against Delta now. So Pfizer seems to be not that good after 1 dose, really, 35%, but then 88% after 2 doses. And then 96% effective against hospitalization. AstraZeneca, you can read about that here. We don't have that vaccine in the US, so I'm gonna skip over that. You can read that. This is a study before Delta done in Catalonia. So this was a study on the effects of vaccination among nursing home residents, staff, and healthcare workers in Catalonia that showed a reduction of basically around a little bit over 90% reduction in infection in those cohorts, and an even bigger reduction in hospitalizations and mortality among nursing home residents for up to 2 months. And that was before Delta, so the number is probably a little bit lower, but still showing the effectiveness of the vaccination among those residents. And then I was looking up basically Pfizer, Moderna, and J&J, and what is the data for vaccine effectiveness against Delta? And when we say VE or vaccination effectiveness, we're talking about symptomatic infection. So basically, how effective is the vaccine in preventing cold symptoms and symptomatic infection? This is not about hospitalization per se. Pfizer, 7 studies, it really ranged across the board, 42 to 96%. That's a huge range of effectiveness there. This is after both doses. Again, only 1 dose, not going to really be that effective. Moderna, around 76% effective, although in the Mayo study, Moderna did get a little bit higher ratings than Pfizer on the effectiveness. Unfortunately for the J&J, there was no significant quality data on the J&J. There was 1 limited study of only 20 patients that showed that there were some antibodies against Delta from the one-shot J&J, but that study seemed to be directed by industry, meaning by J&J itself. So take that with a grain of salt, a whopping grain of salt, I would say. Generally, they are all effective. And according to the CDC, greater than 99%, I think that number is a bit high, but they're effective against, in general, hospitalizations and death, even for Delta. So side effects, I know some people asked about this, so I wanted to bring this up. We covered this in a previous COVID webinar, but basically, why do people get side effects from vaccine? It's the same reason. It's why people get side effects from the infections versus vaccine. So it's an increase in an inflammatory cytokine called interleukin-6. And these side effects might be fever or chills or nausea or headache or fatigue. And so these are to be expected, I think, with a vaccine. There are rare side effects. So there's 100 cases of GBS or Guillain-Barré syndrome seen out of over 12 million shots for J&J. And that was mostly in men age 50 plus and 2 weeks after injection. There's also some blood clotting rare effects here in AstraZeneca and J&J as well. And you can read some of the results in there. And there's myocarditis that's been seen mostly in young men in the mRNA vaccines, Pfizer and Moderna. And then there have been some menstrual irregularities reported, not necessarily about fertility. The American College of OBGYN, Obstetrics and Gynecology, does recommend vaccination and is not concerned about the impact on fertility. And the CDC has recently put some information on there as well. Doctors Lee and Clancy do have a survey if someone's interested to report menstrual irregularities. They're going to do an open label study on this. And so that's a link for that if you want to look at that. And then these are studies before Delta, but there's a Siren study and a Marine study, but basically it showed that people with natural immunity that had COVID did have a reduced risk of infection, a lower risk of infection and symptoms for at least 7 months in the Siren study from the UK. And then the Marine study, basically healthy Marines, healthy Marine means in the armed forces that were seropositive had about 1/5 the risk versus seronegative individuals. And that they were less likely to transmit because they have had because they've had infection before. This was before Delta though. So siren and marine study, those are interesting studies. And then going to natural immunity again. So this is a study and statement from a journal, Nature, so a very respected journal. But basically, people with prior infection from COVID, from the COVID alpha variant, may not be fully protected from Delta based on the reduced potency of antibodies against alpha versus Delta, likely due to spike protein mutations in the Delta variant. This does not account for the T cell response that can also be protective against COVID. Like I said, if you go kind of past that first line defense, you still have the T cells you run into that the virus has to run into as well. And this is a study that was shared to me, so thank you for sharing this here. A study from Thailand that's a preprint, but it does show that the Delta, especially, in the Delta, there was a significant difference in the neutralizing antibody titers against Delta following a vaccine from China called CoronaVac. They studied CoronaVac. They didn't study Pfizer or Moderna. But basically, I will just go to the next slide here because I think that's interesting. If you look at the bottom right, you'll see that the NAB titers, or neutralizing antibody titers against the Delta variant, which is right here on the bottom right, were higher, significantly higher in the natural infection groups from 2020 and 2021 versus the people that got the CoronaVac vaccine. It still was protective, it still had some antibodies, but certainly the natural infection seemed to be better for Delta. In the previous versions, like the wild type, the alpha and the beta, it looks like there was no significant difference there. But as you kind of move through time and the variants become a little stronger, the natural infections seem to actually give you more antibodies. Okay, so I wanted to touch on Lambda because I just want to kind of get ahead of it a bit. And so the Lambda variant is actually called C37, and it is now the dominant variant in Peru, Argentina, Chile, and Colombia. Delta is dominant in Brazil, which is another large South American country, as you know. This has been found in more than, in most states, I think at least 42 states, including Maryland, but has not gained traction here because Delta is so dominant. But I just wanted to bring this up because there was a study by Kimura et al. That showed an effect of Lambda against Pfizer. And basically what it said was that this 7 amino acid mutation, which is a deletion mutation in the N-terminal domain of the Lambda, is responsible for evasion from neutralizing antibodies. So there's mutations that are kind of combining with each other, I would say, in terms of the virus. So their conclusion is that Lambda was 1.5 more times resistant to neutralizing antibodies versus the spike protein associated with the original strain. Personally, I think that it's hard to know if Lambda is going to overtake Delta. I'm not sure. I think Delta also has some evasion techniques as well. So it may be as strong as Lambda, but who knows what will happen. I just want to bring that up. That is pretty dominant now in most of South America. All right, so we're going to talk now about the lines of defense that we have in our immune system. So we have first line, so we have mucous membranes, secretory IgA, natural killer cells, mast cells, macrophages, which have a white blood cell that gobble up viruses and things like that. So we want that to be really strong. That's something that we want to be strong no matter what is happening in our lives, in our world here. Now, second line, we're going to be looking at neutralizing antibodies from B cells, whether from a natural infection or from vaccines. We're going to be looking at if the COVID-19 gets past neutralizing antibodies in the upper respiratory tract and gets inside cells, then your T cells start activating. Your helper T cells, or the CD4 T cells, your cytotoxic CD8 T cells are going to also activate and start killing off those COVID, often killing off those COVID infected cells or trying to kill off the virus, basically. So it is kind of a race against time, because if the virus replicates faster than your B cells and T cells can replicate, then you have a problem, because then the virus is just, the load is just too big. If the load is too big, then you can get systemic inflammation, respiratory failure, hospitalization, death, etc. So that's where your T and B cells have to be strong and have to be ready enough to fight off the virus and to stop replication and to kill off viruses so that it can kind of do its job and keep you alive. So that's what I'm talking about in terms of race against time. Now, I thought this was really, really an interesting study. So Griffoni et al. Talks about targets of T cell responses to the novel coronavirus in humans with COVID disease versus unexposed individuals. So what this means is that people that haven't gotten COVID yet, right? Or, they just haven't gotten COVID yet. So, but they actually have COVID T cell specificity. So why would they have that? It's because there's 6 other coronaviruses circulating around. So they've gotten coronavirus over the past years or decades, and there's still some T cells sitting there waiting to cross react. So maybe half of people might have that. And this could explain the difference, not all the difference, but some of the difference between why someone gets COVID and does pretty well, or is even asymptomatic, versus someone that gets sick and goes to the hospital. So there may be some kind of latent sort of pre-recorded, so to speak, T cell response from other coronaviruses that people have been exposed to in the past that's protecting some people. All right, so this is going to go deep here, so I hope you stay with me here on this. So I kind of thought about this as I was doing these hours of research, and what is the purpose of a virus? We know what the purpose of our gut is. We know what the purpose of our immune system is, to defend ourselves and to keep us healthy and things like that. We know the purpose of our brains. We know I think know our own purpose in life. We try to look at that as we want to know our own life purpose and find joy and purpose in our life for our own health. But what is the purpose of a virus? Like, why is it even here? I mean, the basic purpose of a virus is very simple. A virus isn't thinking about what it's doing. The purpose of a virus is just to be itself, to propagate, to keep on propagating. So, we have right now an epidemic, and we have a lot of people with COVID and a lot of circulation. But at the same time, will the COVID pandemic virus become endemic at some point, where it becomes, rather we have an epidemic, but then we have a pandemic, I should say, a worldwide pandemic. When is the pandemic going to become endemic? When it basically, is not as deadly, but it's sort of just sitting there chronically in the world population. Because if virus's purpose is to propagate and to survive, then it's not going to eventually want to be something where it's going to want to kill off everyone. If it kills off all the humans and there's nowhere for it to spread, I guess it could go to animals, then it's not really a pandemic anymore, but then the virus didn't fulfill its purpose. So I often wonder about how the virus, and experts are saying this, I mean, not just me, but expert opinion is, will COVID evolve into a common cold that affects kids more than adults and that is not as severe over time? That could very well happen. I believe that could happen. No one knows for sure. I certainly don't have a crystal ball on that, but that would fulfill the virus's purpose, is to keep on propagating, is to be less deadly, but sort of more endemic in the population over time. There is high prevalence, there's high vaccination rates, but remember, these vaccination rates are kind of spread in different parts of the world. It's not like every single country has the same percentage. And so the virus is already spread around the world, but it's sort of not totally equal. So we'll get back to that. So we'll talk about kids a bit, because I know that a lot of people have kids. Kids are going back to school very soon. UK analyses and analyses here in the US, CDC, are showing that deaths from COVID are extremely rare in kids. There are some risk factors for severe disease and hospitalization from COVID-19, which are basically the same risk factors as in adults, which we'll go over in a minute. But deaths from COVID are incredibly rare overall. Now, there are some randomized placebo-controlled trials going on from the mRNA vaccine companies, which are Pfizer and Moderna. The Pfizer trial is a little bit ahead of Moderna, and they're expected to apply for EUA, or emergency use authorization, for ages 6 through 12 by the end of September. About a third of the adult dose is being used in that trial. The Moderna trial is ongoing and is expected sometime after the Pfizer authorization application to happen. So how has Delta affected kids? So previously, before Delta, kids accounted for about 2% of new cases. I was looking this up, that about 18% of new cases are kids now, which is a lot. So even though the severity in kids isn't that much, just the sheer number of cases means that there are some people that are going to get kids that are going to get severely ill from COVID, just from the sheer numbers. There's no data on sort of alpha versus delta coronavirus variants in terms of do they have more symptoms with delta and things like that yet. All right, so next, the boosters. So how many of you are going to get a booster? I'm just a little polling question here. I'm sorry, I will get to the chat. I know I'm probably behind on the chat here. I know that the US officials just recommended the mRNA booster shots for all Americans, or will be available for all Americans, I would say, at least the people that have gotten Pfizer and Moderna 8 months after the second dose, and that will start on September 20th here. Already the CDC has approved boosters for the immunocompromised, so that has already happened. Now let's talk about the evidence for the booster, because I know that that was one question that people had before this webinar here is, okay, the government's recommending boosters. Should I get a booster? What are the impacts of that? And, what kind of factors would come into play with my decisions to, my decision as an individual person of the pharmaceutical trial data. So it's not like new stuff, it's stuff that was happening when they were applying for the EUA from 7 different vaccines all across the world. And this modeling predicted that showed that neutralizing antibody levels are highly predictive of immune protection from symptomatic infection. So we're really talking about symptomatic infection here. Modeling does suggest a protective effect from the boosters because the neutralizing antibody titers are going to be higher, but also that if you have already gotten a vaccination, that it would not significantly impact the intact protection that you already have against severe disease. So we'll talk about that in a minute. The CDC just released 3 studies, and that was just released yesterday. So how has Delta affected sort of vaccine effectiveness? So there's 3 studies, the New York State study, Tenford, and Nanduri. So basically, the summary of all this, Jen, are we good on time? Yeah, I guess we're good. Basically, it showed that with the Pfizer and Moderna vaccines, that vaccine effectiveness stayed pretty stable over a 6-month period, and it was even sustained among groups that were at risk for severe COVID-19, people with immunocompromise, and 21% of people in that study were immunocompromised. So that's a big percentage there. So I think that's probably the biggest one is that middle study, the Tenford study. Overall, we do know that vaccine effectiveness has gone down because of Delta. In the New York State analysis, it declined from 91% to about 79.8%. It looks like in the other one from Nanduri, it was 74.7% for nursing home residents. That was the effectiveness there early this spring. And then when Delta started coming about, the effectiveness actually declined to 53%. So this is a group that is, highly susceptible to COVID, the nursing home group. And, I think that makes sense to potentially look at boosters there. So to get or not to get boosters. So that's the big question. It's a personal choice at this time. There's no right answer. Again, if you've gotten the J&J, you are currently not eligible for it. I think they're going to roll that out later. Currently, it's limited to people who have gotten the mRNA vaccines, meaning the Pfizer Moderna vaccines, and you'd have to wait 8 months after your second dose. Industry-funded science from phase 1 through 3 clinical trials does suggest efficacy of the boosters in the lab against symptomatic disease, but how does this play out in the real world? Is it really reducing the risk of severe illness and death? It doesn't seem like it is based on the 3 trials that I just showed you. But you do have to risk stratify, what is your age? What are your comorbidities? What are some health factors that might either decrease or increase your chance of serious illness, whether you've gotten the vaccine or not? The pandemic is global. That's the other thing. We just showed you this idea of, 80% of the world has a lot of the vaccines, and then, 0.3% in the poor countries. So if that's happening, the continued evolution of variants is very likely when the availability of vaccination is not equal. So we have to start thinking of ourselves not only as a country like the United States, but also as a world. And we're all in this together as a world. And so, we have to think, how is that going to be effective if on a public health level, if most of the globe is not vaccinated yet. This is just something I want to bring up in case anyone's interested is if you've had asymptomatic COVID, meaning you don't know if you've had COVID or not, or maybe you've had symptomatic COVID, but you tested negative through the rapid PCR test, there is a test called T-Detect that there's a website right there you can go to, and it measures T cell response, and that would measure if you've had COVID or not based on T cell response. It's probably a better test. It's not a standard test, but I think it's very science and innovative based. I think it's not considered gold standard, but I think it can be really helpful if you're wondering about that. Okay, so let me see. I think, Jen, let me know on the questions if there's anything. I want to get to them, and might have to stay a little longer, which is fine.
There are some questions specific to the vaccine that were just entered that you might want to look at.
Okay, just
the
read them
bottom of the
to me
chat.
and then, okay. Let's see. Does the booster shot contain the same ingredients? The booster is the exact same shot as that's my understanding, as the first two vaccines. It's just the same shot, basically. Why wait 8 months and not sooner? I think it's related to the studies on the 6 months, but they could have said 6 months. So I don't know why it was 8 versus 6 months. If you got one of the mRNA vaccines, would a J&J booster be of interest? No, I don't think so, no. To me, what would make sense is if someone got the J&J and wanted a booster from the mRNA, that would actually make sense. Okay. Yes, the risk factors. Thank you, Helen. I will. Yes, I think there's still risk factors there. Yes. Okay. Opinions for vaccinations for children under 12. I think the data is not there yet, so I probably won't really comment on that right now. But yes, I will definitely share my thoughts about it when things are out there more. Yeah, the T cell test is different because the IgG, IgM test are testing B cell response. So T cells and B cells are different arms of your immune system, kind of like you have your Army, your Navy, your Marines, your armed forces in general have a label called armed forces, but there's sub forces like Army, Navy, SEALs, etc. So your T cells and B cells are like that. Is the T detect a better indication? I don't have a lot of experience with it yet. I think that it can tell you about if you've had an infection or not. I don't think it tells you if you had an active versus past infection. But if you had a negative test and you felt like you had COVID before, then that could be a good test to do to see if you have some sort of immunity. Let's see. Thank you for all the questions. I don't know about Novavax. That's a great point. I did go to the beach. Yeah, thanks, Darcy. I just went with the beach last week with my family. That was great. Thank you. Okay, so I'll get to more questions here. Okay, so long COVID-19. So what does that mean? It means that if you have COVID-19 and you have some sort of symptoms 8 to 12 weeks afterwards, this is kind of called long COVID, these symptoms that are persistent. A UK survey estimated that 13% of people who've had COVID have symptoms after 12 weeks, things like fatigue or coughing or muscle aches or headaches. I also see people with depression or brain fog and things like that. And this can affect up to a quarter of people post-COVID. Interestingly, kids seem to have long COVID much less than adults. Only 1.8% or less than 2% have symptoms after 8 weeks in kids. As you know, because we do functional medicine here, we're trying to always figure out what the root cause is. So doing some research into why people get long COVID. One group of researchers is thinking about how autoantibodies against a multifunctional protein called annexin A1 could be driving the pathophysiology of long COVID. So basically the immune system is attacking different proteins that are involved in cell signaling and membrane transformation, transportation and things like that. So basically your whole body gets affected because annexin 1 is in your whole body. So could be, if that's true, we'll have to come up with some strategies, for that. I'll just mention that, in case anyone has long COVID and is kind of wondering about what we do here, we've had people that have been really helped with things like IV nutrition or LDN or Ivermectin. So if anyone wants to chat about it, or anyone who has been treated here, feel free, and you're comfortable with that, feel free to talk about that. But we have experience with that, and we're also learning as we go on this too, because it's all new for us too. This is actually a paper from one of our community members here. So thank you so much for sharing this as well. Redox imbalance links COVID-19 and ME and chronic fatigue. So basically what this is saying is that people with acute COVID and with ME, CFS have biological imbalances that are very similar. oxidation reduction imbalance, systemic inflammation, inflammation in the brain, and impaired ability to generate energy, which is ATP, and generally a hypometabolic state where there's not enough energy. So I think this is a really important point as we start kind of dealing with more of the fallout from this with the long COVID situation. And here's a little nice graph on this paper. So thank you so much for sharing that. So let's talk about the next frontiers of how we reduce inflammation, because really if you reduce IL-6, you're gonna augment your health in all levels and all parts of your body, really. So whether someone has arthritis or heart disease or dementia, IL-6, it's a chemical messenger, and some of it is good because it helps us fight off infection, actually. But too much of it is bad because IL-6 is the main driver of the cytokine storm that accounts for most of the morbidity and mortality that's associated with COVID. So you see here in stage 1, 2, and 3 of COVID, eventually it gets to this hyperinflammatory phase where there's a cytokine storm, which can lead to severe respiratory problems and other systemic problems. So how do we reduce IL-6? Super, super important. That's why I'm kind of doing this. The important point for this slide here to take charge of your health is how do you reduce IL-6? There's some research on this, some ways to reduce IL-6. So you want to kind of have that baseline IL-6 be lower. Different nutritional compounds like apigenin and parsley or fisetin and strawberries, luteolin and many fruits and vegetables, EGCG, which is a green tea extract, turmeric or curcumin. You can see the list here. Well, I don't read the whole list to you, but you can see that there's a lot of things you can do to reduce IL-6. You also want to reduce high glycemic index foods and heated starchy foods that will increase acrylamide, which is basically an inflammatory compound, and it's found in, unfortunately, things like French fries and toast and things like this. So fried carbs, toasted carbs, not really good for IL-6. They taste good, but not good for IL-6. You also want to address stress, depression, and sleep quality, because those are gonna, if those are off, that's going to raise IL-6. You want to balance that out by addressing those as well. D3 is very important. We'll talk about that in a minute, but that does decrease IL-6. Medical treatment. So we have Regeneron, budesonide, which is a steroid. Ivermectin we've used a lot here. I had seen a lot of success there, at least with regards to helping people out with regards to treatment. This is not an FDA-approved treatment for COVID, by the way. We have found clinically it to be helpful for people, though. We've had people get better with long COVID from ivermectin as well, just FYI. And then Pfizer is also developing a protease inhibitor oral medication that is in development right now in some of the clinical trials. Sorry, wrong thing. Let's see. So then we have an EMT study. I just learned about this today. Actually, thank you for sharing this as well. So this is if someone has COVID and has a loss of smell. And this study was done over like a 5-day period, but in 5 days of a steroid nasal spray and steroid oral paste, they got the participants got their smell back, which is pretty good. Also using essential oils like citrus oils, rose, eucalyptus, and cinnamon can really help. Now, this is a really, really important slide. So we talked about sort of kids and adults, and I think some of the risk factors are very similar in terms of, what are some of the risk factors for COVID? What are some of the risk factors for worse outcomes from COVID? Blood sugar is a big one. Blood sugar regulation, not only diabetes. Thank you, Ayla, for this share. Ayla, one of our functional nutritionists here. It's not just diabetes, but it's also pre-diabetes and high insulin and things like that. So elevated blood sugar does promote viral replication. Why? Because viruses like sugar. I mean, viruses like energy, just like our own cells like energy. So have a higher blood sugar, virus is going to replicate more. Virus is also going to bind to the ACE2 protein more, which means that it's likely to infect you more if you have elevated glucose. And then, of course, you have worse COVID outcomes because glucose increases inflammation overall. 80% of the US has metabolic syndrome based on stricter conventional criteria. So based on that, 9 out of 10 of us need to reduce that blood sugar, reduce that inflammation. And what does that do? It's going to create immunocompetence. It's going to actually improve your immune system, the competence of your immune system. You don't want to have an incompetent immune system. You want your immune system to be working. So what are some of these risk factors that we need to address? Diabetes type 2, but also pre-diabetes, elevated blood sugar, obesity, overweight, hypertension, cancer, chronic lung conditions like asthma are all risk factors. And all these conditions lead to dysregulation of the immune system. So what can we do about how do we have a competent immune system. I think this might be too much and we might run out of time, but I'll just say we want to increase our T regulatory cells. We want to look at the vitamin D, get the vitamin D level up in general, talk to your providers, increase short chain fatty acids, which is going to really help the, but by increasing the health of your gut microbiome through soluble fiber found in fruits and vegetables and fermented foods. And you also want vitamin A a little bit because it's co-regulated with vitamin D. So very important for that. You also want to reactivate your thymus gland. So age 40 and up, your thymus gland starts to shrink a little bit actually, and your T cells are not as active. So how do we increase your natural killer cells and your thymus gland, which is gonna support your T cell generation? Things like transfer factors, melatonin, zinc, getting out in nature, exercising, massage, acupuncture. These are all things that have been helpful for natural killer cell and thymus activation. Different mushrooms, including shiitake is my favorite there. And then there's some other things like thymus glandular extract, T4 peptide, which is thymosin alpha-4, red light therapy to the thymus, etc. So there's a lot of things you can do, but just the general sense is that you want a competent immune system regardless of what happens. You also want to increase your secretory IgA levels. This is an antibody that patrols your gut. It patrols your other mucous membranes, including your respiratory tract. All that pinkish, part of your nostrils, that's mucous membrane. So you want things like colostrum or optimizing the gut microbiome. That's going to increase your secretory IgA levels. And you also want to balance and optimize your hormone levels. Not to say that everyone has to go on bioidentical hormone replacement, but you want to make sure that your adrenals, your thyroid, your sex hormones are balanced and that they're healthy levels. You can see that all the different types of hormones that are, if the levels are healthy, that's associated with better outcomes in COVID-19 patients, which is a lot of things: cortisol, T3, testosterone, estrogen, progesterone. And then I think these are really interesting studies that probably don't get a lot of press, but steroid hormones, retinoids, and vitamin K may stabilize rather the closed conformation of the spike protein. So in other words, vitamin A, vitamin D, and steroids and vitamin K may close up the spike protein so it cannot infect your cells. So that's why these things are important. Natural protease inhibitors to reduce viral replication. So these things are not FDA approved, but cocoa and green tea extract have been shown in some basic science research to inhibit protease, viral protease. And then other things that we do sort of in functional medicine. So sort of analyzing and optimizing the microbiome, micronutrients, and nitric oxide status. I will spend a little bit of time on nitric oxide. So you want a good amount of nitric oxide. And how many people here know about nitric oxide? That is a gas that your body produces that basically opens up your arteries. Why is that important? Because in COVID, you're getting vasoconstriction. You're getting a clamping down of your arteries. So you want to have a baseline high level of nitric oxide so you're more protected. So you can get the blood flow to your to all of your cells. If you have immune cells that are working, but you don't have the highway and the bloodstream to get it there, then it's not going to help. So you need the nitric oxide. You need the immune system, but you need your circulation to work as well. Okay. So IFM, Institute for Functional Medicine, we all, I think, got trained. A lot of us got trained there. IFM has a bunch of information, good information on different protocols for COVID-19, specific nutraceuticals and botanical agents. I hope this was helpful for you today, reviewing evolving guidelines for vaccination, for masking, social distancing, boosters based on the Delta and perhaps future variant. We did spend some time talking about lifestyle, nutrition, and nutraceuticals. These are all important moving forward so that we can downregulate inflammation, reduce risk factors, and improve your immune system so you can take charge of your own health and so you can really up-level your own competent immune system, again, what we call immunocompetence. So future global directions, rethinking, thinking about ourselves, not in terms of just the United States, but also the planet, our global public health. Are people getting enough of the, equity of like vaccines and healthcare and integrative health and lifestyle? Are people having healthy nutrition, and things like that? Rethinking of immunocompetence versus immunosenescence to take charge of your own immune system, to acknowledge, but also to overcome fear, because fear is also bad for your immune system. And to how to create a world, and I'm love to hear your thoughts on this, how to create a world with increasing access to integrative health and lifestyle medicine. And then rethinking of what, this time has also taught us, I think, rethinking of what is important to you and what brings you joy, love, wonder, and purpose in life. So thank you for standing with us. I know we have a couple minutes for questions. We're all here for you and with you, and we're all in this together. So thank you very much. And I hope this was helpful for you. We have a couple questions here. Thank you, Marlene. Appreciate it. Thanks, Amber Mustafa. Thanks, Kiana. Thanks, Kara. Appreciate it. Good to see everyone. I hope everyone's healthy, staying healthy. And I don't know about AHCC. That's a good one. That's a good idea. Thank you, Helen. Let's see. Yes, take charge of our own immune system. I agree. Thank you, Kiana. Thank you, Jody. Thank you, Basilio. Thanks for the share as well. Thank you, Laura. Okay, so the supplement is yucky. Yeah. Yes. Yeah, you can totally, I agree, Kiana. Not the best tasting supplement on the Neo 40 for the nitric oxide. It is effective, I think. The nostril breathing is great. I do that myself. Nostril breathing, really, really helpful for nitric oxide. Yes, good point, Basilio, about the omega-3s. Yeah, I like that. And there are tests you can do to check that. Yep. Vitamin D, yes, thank you. Let's see. Qigong, oh, great, that's nice. Okay, thank you, Darcy. Thank you so much. Let's see, can you post a link? Yes, I think the link is on there. I think the link is on there for the returning the sense of smell. If not, we'll add it. Lungs free of residual mucus, definitely N-acetylcysteine. Sorry, I'm going backwards here because there's so many messages. So yeah, but definitely N-acetylcysteine is going to reduce that. It's going to be a mucolytic there. I think that definitely makes sense, that there's some evidence for that overall. Oh, I like the air diffusers. Yep, that's great. Decaf coffee. I'm not sure, Kathleen, what the question is there. Oh no, I don't think it's is it the caffeine? I'm not sure. I'm not sure about why. Is it the caffeine or the coffee itself? I'm not sure about that. And that's a good question though. We'll have to look into that. Yeah, thank you, Jody. Thank you. Yes, higher IL-6, that would be associated with increased risk of rheumatoid arthritis and osteoarthritis, etc. In general, coffee, I don't want to get too caught up on the coffee, the 1 cup a day thing. Coffee does have chlorogenic acid, which helps reduce blood sugar, actually. I think if you're drinking black coffee without sugar, that is generally healthy. You could go to decaf if you want, different things like that. Okay. Yes, it's definitely easier to be depressed when one has COVID. Yes, I definitely see that.
There's a question towards the bottom from
yeah.
Deborah. Still not clear about the path for J&J vaccine recipients. Will we be able to get an mRNA booster after 8 months?
Yeah, I think the CDC and the government will announce that sometime later in the future. That the idea is they would get the people that have had the mRNA vaccine through Pfizer, Moderna first, and then they would do the. Personally, I think it makes more sense to do the booster for the J&J actually, but that's my own personal opinion. It's not an official opinion. Yeah, I think that would make some sense. Okay. Yeah, sure. We can have another webinar on Qigong. Yeah, thank you, Gede, as well. Thank you so much. Is it safe for immunocompromised? Yeah, if everyone's masked, I guess you have to kind of do your own calculus of risk benefit there in terms of going to stores and crowds and stuff. Masks, in theory would reduce transmission. Does everyone wear a mask all the time? Probably not. Certainly if people are eating, people are not wearing masks, right? So depending on if you're going to a mall, I don't know if that's the best place there, but so it's hard to answer that question. It's a great question though. Thank you, Carrie. Yeah. Yeah, we have the mRNA. We have a webinar. I think one of the first ones we did on COVID, we put in there all the different mRNA vaccine components. So maybe Jen, you could point Susan out to that one. And yeah, I mean, there certainly are still unknowns about it, although many doses have been given now. So I think some of the things have been known more. NAC is hard to find. Is that true now? More so?
Yeah, it is.
Thank you, Margaret. It is, okay, yeah. Just thank you, Bobby. Thank you so much. Coffee, yeah, coffee for boosted energy. Okay, thanks, Darcy. All right, I'll try to get up to the top questions because I know there are more. Spike proteins can cause potential problems down the road, such as blood clots. I mean, in general, if you think about infection causing an uptake in IL-6, that could potentially increase inflammation and blood clots, but you have to look at fibrinogen and other things too. T direct testing is done directly, like you would literally just go on that website and buy it, and I think you can just get it done. That's my understanding of it, but let me know, Carrie, about it. Pneumonia vaccine, I think it depends on your age and the CDC guidelines for that, and you can follow that basically. Yep, thank you, Basilio, on the long COVID. Let's see, I think, did I answer? Let me just see. Let me go up to the top because there might have been more. Thank you for staying for longer too. I know this is there's a lot of information here, so thank you for the attention. Thank you, Karenina, I appreciate it. Let's see. The VAERS database numbers, I didn't put that on the slides. I think that's definitely evolving, and yeah, we are looking at that. Yeah, for sure. Thank you, Carrie. Let's see. Yep. Yeah. N-acetylcysteine, great. I think even, if you're taking glutathione and you're having trouble digesting protein, you might want to add some N-acetylcysteine because otherwise your body might try to break down that glutathione into glutamine, glycine, and cysteine. So you might want to add a little bit of N-acetylcysteine there. Let's see. Sarah, what do you mean by antibody dependent enhancement? Maybe we covered that already. Just if you could talk about that. Yeah. Yep, I think that's good. NACD and quercetin, those are good. You can get quercetin from apple skins and onions. Apple skins is one of the best ways. Although if you have SIBO, talk to your nutritionist about that here. But if you don't, then apple skins can actually boost akkermansia, and it can help with as source of soluble fiber and quercetin. Okay. Thank you, Jem. Appreciate it. Thank you, Bianca. I really appreciate it. Let's see. PCR really reliable. Yes. I mean, I think the statistics on it, they are reliable, but in practice, I've seen the missed cases too. So, I think it depends on where you are on the illness course and like how well your body's been able to fight off things in terms of B cells going to your nasopharyngeal passages and having some, viral killing there. So then you may not be positive even if you had symptoms initially. Yeah. Okay, what else here? Yep. Yep. So for everyone who has COVID or has had COVID too, I hope you get better soon. I hope that, heal up really quickly, sending good thoughts to you, healing energy to you. I think I got the, yeah, Margaret, you can see Margaret's comment, Jen. I think it's great to, we will do some special telehealth and webinars and things. Let us know what you're interested in. Certainly we want to do some more of these with COVID because, chanting, oh, that's great. Okay, I think this is good. I just want to make sure to, okay, so thank you for all the messages. All right, so I'll go back to the bottom here. Yeah, melatonin is great. COVID can cause lung scarring. Yeah, that's why things like curcumin can be really helpful, glutathione, etc. Try to get ahead of it, that's very important. Yeah. Yeah. Oh, beets and beet powder for NO. Thank you. Thank you, Ayla. Yeah. That's great. All right. Well, I think we are good. We are good to go here. Thank you so much again for attending, participating. I wish you all the best in health and healing, and we will see you all very soon. And have a great rest of your summer, and we will talk to you very, very soon. Thank you so much.